Okay, good morning. So we will talk today about how to evaluate the dynamics of face-to-face consultations that follow an asynchronous teledermatology session. And this is an issue that can have a great impact on the decision whether and how to implement such a platform. So I will present the results of a study we performed in Maccabi Healthcare Services, which is the second largest HMO in Israel, with almost 2.5 million members. We have 200 dermatologists, and we have almost 40,000 face-to-face consultations every month, which is 1.6% of the population. So in 2019, we implemented an asynchronous teledermatology platform. We have 15 senior teledermatologists running the consultations. They were reimbursed the same as face-to-face consultations. And also physicians and patients were all instructed not to send consultations regarding neoplasms and pigmented lesions. And in order to evaluate the performance of this platform, we had quality measures and quantity measures. Quality measures refer to the clinical quality of the consultations. I will not talk about that today. I'll tell you the results were good. I will talk about the quantity measures, which have a financial impact when implementing such a platform. And the two important measures that we measured was the rate of the following face-to-face consultations and the rate of the cases that patients still send, which are not suited for teledermatology. So this was a retrospective study. The study period was 18 months between 2019 and 2021, which was shortly before the COVID pandemic, which was completely accidental. The study population were all patients who used the teledermatology platform. And we measured the rate of the following face-to-face consultations during the next 5 months. I'll explain later why 5 months, and the rate of cases which were unsuited for teledermatology. So we had almost 13,000 patients sending over 16,000 consultations. Together with the face-to-face consultations, there were over 25,000 consultations, 15 dermatologists. The average time for response was 27 hours. This is the age and gender distribution. It's most common between the ages 25 and 45, more by females in that age group. And this is the distribution by diagnosis. The most common diagnoses were different forms of eczema, followed by onychomycosis. And this is the answer to the question, what is the rate of the following face-to-face consultation? It, of course, depends on time. In time, of course, 100% of the patients will have a following face-to-face consultation, but you can see that lower curve you see over here is the curve of the general population with 1.6% of the population. It's the additive curve every month seeing a dermatologist. And the upper curve is the rate of the patients after they had the teledermatology consultation. You can see that after 5 months, the slope of the curve is similar to that of the general population. That's why we decided to stop after 5 months. And you have to stop somewhere. And as you can see in the curve, after 2 weeks, a third of these patients had the following consultation. And it makes sense that the closer you move in time to the teledermatology consultation, the bigger the chances that it relates to the teledermatology consultation. So these were the cases we analyzed. We tried to understand why did they have this following face-to-face consultation. So these were 901 patients, and 30% of them, the reason why they had a following consultation in the 2 weeks after the consultation, because the case was not suited for teledermatology. In 15% of the cases, it was for a completely different reason. And then 55% was for the same reason, like be a follow-up and treatment or failure of treatment. And regarding the cases that were not suited for teledermatology, so out of the 16,000 cases, 17% of them, which is a lot, I think, were not suited for teledermatology. This includes cases with a blurry image, a pigmented lesion, or sometimes just don't understand what the patient wanted in his consultation. So we found that 33% of them had, after that, a following teledermatology consultations, 35% of them had a following face-to-face consultation, and 32% just did not have any following consultation after that. And this is where we feel that we really need the help of AI to try to identify these cases before they reach the physician and tell the patient, take another image, or this is not suited for teledermatology, you should see a doctor face-to-face. So we can really use AI here. So to summarize, we have the answer to the question of what's the rate of face-to-face consultation is a curve We found 30% after 5 months, 11% after 2 weeks, and we had 17% of the cases that sent cases which are not suited for teledermatology. And thank you.